Bismillahirrahmanirrahim. Today I am going to discuss the autonomic nervous system. In this lecture I will discuss the physiological anatomy of autonomic nervous system. The nervous system. The human nervous system consists of central nervous system and peripheral nervous system. The central nervous system. The central nervous system is divided into two parts, the brain and the spinal cord. Peripheral nervous system. The peripheral nervous system consists of cranial nerve, which are 12 pair in number, and their branches. Here you can see in this picture there are 12 cranial nerves: the olfactory, the optic, trigeminal, the facial nerve, vestibulocochlear nerve, and glossopharyngeal nerve, vagus nerve, and accessory nerves. Peripheral nervous system. Peripheral nervous system consists of spinal nerve, which are 31 pair, and their branches. So the nervous system is divided into central nervous system, which is further subclassified into brain and spinal cord, and the peripheral nervous system subclassified into sensory nervous system and motor nervous system. The motor nervous system is again classified into somatic nervous system, which is responsible for voluntary movements via skeletal muscles, and autonomic nervous system, which is responsible for control of organ consists of smooth muscles. Autonomic nervous system is further classified into sympathetic, which is responsible for fight or flight response, and parasympathetic nervous system responsible for maintenance of the body. Functions of autonomic nervous system. The autonomic nervous system mediates actions that occur without voluntary control, such as heart rate or blood pressure, gastrointestinal motility, gastrointestinal secretions, urinary bladder emptying, sweating, body temperature. It consists of both the sympathetic nervous system and parasympathetic nervous system, and they often act in complementary manner. Characteristic. One of the most striking of the autonomic nervous system is the rapidity and intensity with which it can change visceral function. Within 3 to 5 seconds, it can increase the heart rate to twice normal, and within 10 to 15 seconds, the arterial pressure can be double, or at the other extreme, the arterial pressure can be decreased low enough within 10 to 15 seconds to cause fainting. Sweating can begin within seconds, and the urinary bladder may empty involuntarily also within seconds. The autonomic nervous system has 3 divisions. Anatomical divisions are sympathetic division, parasympathetic division, and enteric division. The autonomic nervous system uses 2 neuron efferent pathway is utilized by the autonomic nervous system. Here in this picture you can see that this is the neuron of the autonomic nervous system, which are 2 in number. The preganglionic neuron, this is the ganglia. The nerve before the ganglia is called the preganglionic neuron, and the nerve behind the ganglia is called the postganglionic neuron. So the autonomic nervous system uses 2 neurons for its functions. Neurochemical, anatomical, and functional difference between sympathetic and parasympathetic division. The 3 divisions have neurochemical differences. The sympathetic and parasympathetic division differ in anatomic origin and function. The autonomic nervous system is also called general visceral efferent system because it controls the functions of viscera. The control function of autonomic nervous system control all smooth muscles, control the activity of cardiac muscles, and secretion of or inhibition of all glands. The autonomic nervous system has no supply to the neuromuscular junction or skeletal muscles. General organization of the autonomic nervous system. The autonomic nervous system is activated mainly by central located in the spinal cord, brainstem, and hypothalamus. Portion of the cerebral cortex, especially of the limbic cortex, can transmit signal to the lower center autonomic control. The central nervous system controls autonomic function through a hierarchy of reflexes and integrative center. The hierarchy is hypothalamus, start from the hypothalamus, the cellular sent to the limbic system, and then to the polyneuronal circuit. In hypothalamus, the control is carried by anterior-medial parasympathetic nervous system and posterolateral sympathetic activity. In limbic system, emotional activity, auditory, visual, memory, and thinking are controlled. And polyneuronal circuit control is through thoracolumbar plexus and sacral division. The parasympathetic nervous system, its main function is maintenance and rest and digestion. Supply most of the same organ but cause opposite or antagonistic effect to sympathetic nervous system. Sympathetic nervous system is used for mobilization and increased metabolism. Take part in fight, flight, or fright, or fight, flight, or freeze. In these situations, the sympathetic nervous system is active. In general, the sympathetic nervous system is the pathways through which an organism responds to danger. This can include action of running, fighting, hiding, and generally action used to escape predators. Structurally, sympathetic nervous system consists of many nerve cells found in the peripheral and central nervous system. This allows organism the ability to activate many different responses at once, leading to coordinate flight or fight response. This is important because a slow or ineffective response can lead to the death of an organism. Parasympathetic nervous system. By contrast, the parasympathetic system controls action related to feeding and breathing. These two systems work together to ensure that an animal can survive danger, to be able to grow and produce successfully. Difference between autonomic and somatic nervous system. Axon of preganglionic neuron leaves central nervous system to synapse with the second ganglionic neuron. In autonomic nervous system, the first neuron, when it leaves the spinal cord, it synapses with ganglion, which is called the sympathetic chain ganglia, and the nerve which synapse in this ganglia is called the preganglionic neuron. Axon of the second ganglionic neuron extend to the organ itself. The postganglionic neuron, which originates in the sympathetic chain or in the ganglia, is called the postganglionic neuron. So the autonomic nervous system uses two neurons for its activity, while the somatic nervous system uses only a single neuron which supplies the skeletal muscle, and it originates from the spinal cord, ventral gray matter or ventral segment, and directly supply the organ. Difference between autonomic and somatic nervous system. The first, we discussed that in autonomic nervous system there are two neurons, the preganglionic neuron and the postganglionic neuron. The preganglionic neuron of the autonomic nervous system release acetylcholine, while the somatic nervous system release acetylcholine at its neuromuscular junction. The preganglionic neuron in autonomic nervous system is myelinated, while the postganglionic neuron of the autonomic nervous system is unmyelinated. In case of somatic nervous system, the nerve is myelinated throughout its course from the spinal cord to the effector organ. The postganglionic neuron of the autonomic nervous system either secrete acetylcholine or norepinephrine. Neurons of the autonomic nervous system control smooth muscles and glands, while the somatic nervous system supply is only to the skeletal muscle. Physiological anatomy of sympathetic nervous system. One of the two paravertebral sympathetic chain of ganglion. A ganglion is a collection of cell body of neuron outside the central nervous system. We have two sympathetic or paravertebral sympathetic chain, one on the right side and other is on the left side. And this chain contains the cell body of the neuron that are interconnected with the spinal nerve on the side of the vertebral column. This sympathetic chain is connected with the spinal nerve on the side of the vertebral column, but remember this chain is paravertebral and outside of the vertebral column. The celiac and hypogastric ganglions are also part of the autonomic nervous system. One is the celiac and the other is hypogastric ganglia. Neurons extend from the ganglia to different internal organs. Here in autonomic nervous system, the preganglionic neuron and in the sympathetic chain, and then from the sympathetic chain postganglionic neuron originate and they then end in the organs. Organization of sympathetic nervous system. Sympathetic nervous system originates inside the vertebral column towards the middle of the spinal cord in the lateral horn. As we know that the gray matter of the spinal cord has dorsal horn, ventral horn and intermediate nucleus or region. So the autonomic nervous system preganglionic neuron originate from the intermediolateral nucleus. This is between the two horns of the spinal cord. It is medially located and laterally located. That's why it is called intermediolateral nucleus. And from here, the preganglionic neuron originate. Beginning at the first thoracic segment of the spinal cord and extend to the second or third lumbar segment. This origination of the preganglionic neuron in the sympathetic system start from the thoracic one and extend to lumbar 2 or 3 vertebra. Because itself began in the thoracic and lumbar region of the spinal cord, the sympathetic nervous system is said to have a thoracolumbar outflow. Here, as preganglionic neurons originate in the thoracic and lumbar region, that's why it is called thoracolumbar plexus and its flow is called thoracolumbar outflow. And first into the sympathetic chain. When they originate from the spinal cord, so they end in these neurons and first in the sympathetic chain. And then to tissue and organ that are stimulated by the sympathetic nerves. From here, the postganglionic neuron then pass to the organs. Preganglion and postganglionic sympathetic neurons. The sympathetic neurons are different from skeletal motor nerve in the following way. Each sympathetic pathway from the cord to the stimulated tissue is composed of two neurons, a preganglionic neuron and a postganglionic neuron. This is a preganglionic and this is the postganglionic neuron. In contrast to only a single neuron in the skeletal motor pathway, the cell body of each preganglionic neuron lie in the intermediolateral horn of the spinal cord. Its fiber pass as through and other root of the cord into the corresponding spinal nerve. Preganglionic and postganglionic sympathetic neurons immediately after spinal nerve leave the spinal canal. The preganglionic sympathetic fiber leave the spinal nerve through the white ramus. As we know, the spinal cord has two horns, the dorsal and the ventral, and they contain axon, which are covered by the myelin sheath, so they are white in color. Preganglionic neuron when leave the spinal cord. When the preganglionic neuron come out from the spinal cord, then leave the white ramus of the spinal nerve and enter into the preganglionic sympathetic chain. Then the course of the fiber can be one of the following of the three. It can synapse with postganglionic sympathetic neuron in the ganglion that it enters. When the neuron leave the spinal nerve or enter the ganglion, it may synapse here in the sympathetic chain ganglia. This is its first course. Or it can pass upward or downward in chain and synapse in one of the other ganglia of the. When this preganglionic neuron originates from the spinal cord, leave the spinal nerve, when it enters the sympathetic chain, it may either pass upward or downward and then synapse in the other ganglia of the sympathetic chain. It can pass for variable distance through the chain and then through one of the synaptic nerve radiating outward from the chain, finally synapse in peripheral synaptic ganglia. The other course is that it may pass upward or downward and then without synapse they come out from the chain and synapse in other ganglia. There are two other ganglia outside the sympathetic chain, the celiac and the hypogastric. So these neurons synapse in the celiac or hypogastric ganglia, and from there then they through postsynaptic neuron they innervate the organs. The postganglionic sympathetic neuron thus originate either in one of the sympathetic chain ganglia or in one of the peripheral sympathetic ganglia. So there are two types of ganglions outside of the vertebral column. One is sympathetic chain and the other are peripheral sympathetic ganglia. So the postganglionic neuron may either synapse in the chain ganglia or in the peripheral sympathetic ganglia. From either of these two sources, the postganglionic fiber then travel to their destination in various organs. Segmental distribution of sympathetic nerve fiber. The sympathetic pathway that originate in different segments of the spinal cord are not necessarily distributed to the same part of the body as the somatic spinal nerve fiber from the same segment. Instead, the sympathetic fiber from cord segment T1 generally pass up the sympathetic chain to terminate in the head. From T2 to terminate in the neck. From T3, T4, T5 and T6, these fibers terminate in thoracic. And from T7, T8, T9, T10 and T11, they supply the abdominal organs. And T12, L1 and L2 into the leg. The supply of these segments are to the legs. Here you can see that from T1 the supply is to superior cervical ganglia, middle cervical ganglia and inferior cervical ganglia. And these ganglia then supply structure in the head, the eye, the lacrimal gland, the submandibular and sublingual glands, parotid glands. Here you can see the from T1, T2 and T3, T4, the preganglionic neuron when end in the sympathetic chain, the postganglionic neuron distribute to the superior, medial and inferior cervical ganglia, and they also make a combined nerve which supply to the lung and heart in the thorax. and the superior, medial and inferior ganglia supply to organ in the heads. The distribution of sympathetic nerve to each organ is determined partly by the locus in embryo from which the organ originates. For instance, the heart receives many sympathetic nerve fibers from the neck portion of the sympathetic chain because the heart originates in the neck of the embryo before translocated into the thoracic. Likewise, the abdominal organ receive most of their sympathetic innervation from lower thoracic spinal cord segment because most of the primitive gut originate in this area. The sympathetic nerve ending in the adrenal medulla. Preganglionic sympathetic nerve fiber pass without synapsing all the way from the spinal cord through the sympathetic chain, then through the splenic nerve, and finally into the two adrenal glands. Supply to the adrenal gland is special or different from the other organs. When the preganglionic neuron originates from the spinal cord, it has no synapse in the sympathetic chain or peripheral ganglions, but they pass directly to the adrenal gland. There they end directly on modified neuronal cells that secrete epinephrine and norepinephrine into the bloodstream. Preganglionic nerve end on the surface of the adrenal gland, and the postganglionic neuron are rudimentary or very short, but actually they are nerve cell in nature. They are short but neuron in nature, and they secrete epinephrine and norepinephrine. These secretory cells embryologically are derived from nervous tissue and are themselves postganglionic neuron. And it is the ending of these fibers that secrete the adrenal hormones epinephrine and norepinephrine. Physiological anatomy of the parasympathetic nervous system. The parasympathetic fiber leave the central nervous system through cervical nerve 3, 7, 9 and 8. Additional parasympathetic fiber leave the lower part of the spinal cord through the second and third sacral spinal nerve and occasionally the first and fourth sacral nerve. You can see that the parasympathetic supply to the organ is by third nerve, seventh nerve, 10th nerve and nerve 5 from the sacral plexus second and third, and sometimes supply from the fourth sacral plexus also occur. About 70% of all parasympathetic nerve fiber are in vagus nerve. Here, this is a 10 cranial nerve, and 75% of the sympathetic supply is through the vagus nerve, which is the 10 cranial nerve, passing to the entire thoracic and abdominal organ of the body. You can see that the in thorax, heart and lung, and to the abdominal organs. Therefore, a physiologist speaking of parasympathetic nervous system often think mainly up to vagus nerve. The vagus nerve supply parasympathetic nerves to the heart, lung, esophagus, stomach, entire small intestine, proximal half of the colon, liver, gallbladder, pancreas, kidney, and upper portion of the ureter. Parasympathetic fiber in the third cranial nerve go to the pupillary sphincter and ciliary muscle of the eye. This is the third cranial nerve, and they supply the pupillary sphincter and ciliary muscle of the eye. Fiber from the seventh cranial nerve pass to the lacrimal, nasal and submandibular gland. They are passed to these organs. And fiber from the ninth cranial nerve go to the parotid gland. This is the parotid gland and supplies by ninth cranial nerve. Preganglionic and postganglionic parasympathetic nerve. The parasympathetic system, like the sympathetic, has both preganglionic and postganglionic neuron. Here, like in sympathetic nervous system, there are preganglionic neuron and there are postganglionic neuron. In the same way, the parasympathetic nervous system also have preganglionic and postganglionic neuron. Parasympathetic know the preganglionic fiber pass uninterrupted all the way to organ that is to be controlled. The difference between the sympathetic and parasympathetic is that the fiber from the sympathetic nerve pass directly to the organ and terminate on the organ. There is no synapse in the pre-sympathetic chain or peripheral ganglions. In the wall of the organ are located the postganglionic neuron. In each organ, for the sympathetic supply, the postganglionic neuron are located on the surface of the organ. The preganglionic fiber synapse with these and very short postganglionic fiber, a fraction of a millimeter to several centimeters in length, leave the neuron to innervate organ. So thank you. Please subscribe the channel and press the bell icon for in-time notification and leave your valuable comment for improvement of the channel.